Joining me first, though, Dr. Zeke Emanuel, Vice Provost of Global Initiatives at the University of Pennsylvania, co-host of the upcoming podcast, Making the Call, and co-hosting a special edition of Last Word with Lawrence O'Donnell tonight at 10 Eastern. Hey, Zeke, thanks very much for being with us. First of all, explain the deadly warnings, the alarming warnings from the Surgeon General, Dr. Adams, as well as from Dr. Fauci over the weekend. Pearl Harbor, 9/11, why so alarming?
Well, again, the hospitalizations, the deaths, they are what we call a lagging indicator. They happen several weeks after you get a big rise in the number of cases. And so you see this rise in the number of cases, and then you anticipate we're going to have a rise in the hospitalization and a rise in the number of people who unfortunately die from COVID-19. And that's what they're anticipating. All of that is happening. That happened already. That was put in place 2 or 3 weeks ago before the strong recommendation on physical distancing and wearing masks and things like that happened subsequently. So they're anticipating that, the people who went home from Florida to all parts of the country taking the coronavirus with them, that's probably going to show up and increase the hospitalization and increase the number of deaths this coming week. And so we're going to go from 10,000 to a much higher number over the course of the week. That seems almost inevitable. And I think people are expecting such large increases that it will be a pretty big shock to the system.
One of the things that really came out from last night's White House briefing was, again, the conflict between science, the medical team, and aspirations, the political side, the President of the United States, very frankly, where the President said repeatedly that he himself would even try this anti-malarial drug, hydroxychloroquine, even despite Dr. Fauci previously warning that it had not been previously tested. I just wanted to show there was a moment there where the President at Sunday's briefing was asked about it by Kelly O'Donnell, are you playing doctor? And then stopped Dr. Fauci from answering the question. Let me briefly play that first.
You also weigh in on this issue of hydroxychloroquine. What do you think about this, and what is the medical evidence?
That question?
Yeah. Well, I maybe for the doctor.
15 times. You don't have to ask.
He's your medical expert, correct?
He's answered that question 15 times.
And our reporting backs up the fact, according to Kristen Welker and others on our team, that there was this big conflict on Saturday, a shouting match between Peter Navarro, a trade expert, who claimed that he's a PhD, therefore he knows what he's talking about, that the tests in France and elsewhere prove that this works as a therapy, against Dr. Fauci saying that those tests are not controlled tests and they're not medically sound for this commonly used anti-malaria drug to be used in this instance.
Well, first of all, I do think it's quite natural for the politicians to want a magic bullet. All of us want an answer, some solution, and I think our grasping to chloroquine is the most advanced potential for that. On the other hand, scientists and physicians, I'm an oncologist, we've seen 100 times where you give a medication to someone, they do well, and you think you've got the cure. The problem is that patient was different from many other patients, and when you begin to give a lot of these drugs that worked with one to lots of them, it turns out it was probably what we call in the field patient selection. You selected someone who was likely to do well anyway. They happened to get the drug and they did well. And you don't know whether it was a drug or they were just going to do well regardless. And I think what Dr. Fauci is saying is, look, a lot of the data from China and from France, those were open label. People knew what they were giving. They were giving it to patients who they thought were going to, they could help and were probably going to do well regardless. And so we don't know that the drug's actually working. The second thing I would emphasize, Andrea, is I've talked to a lot of virologists and experts on coronavirus, and almost everyone to a person says, look, this isn't going to be a single magic bullet. One drug is going to cure everything. We're probably going to need multi-drug regimens, just like we have for HIV, where we have 3 drugs together to control the disease, or cancer, where we frequently have to treat with 2, 3, 4 drugs all at the same time. And coronavirus is probably going to be that. So just having one drug, right, it'll lift people's hopes, but it won't be enough. And I think Dr. Fauci is trying to sort of tell people to be more sober, not paint an overly rosy picture based upon a few patients that aren't representative of the whole pool of people. The last thing I would say is I've talked to a large number of virologists again, and one of the things they emphasize over and over is when you give the drug, maybe as important as the drug itself, giving it too late in the course, you may not actually be able to reverse the condition. Giving some drugs too early, they may not be ready to be effective. And a lot of the experts I were talking to is we're probably going to need a drug that's good against the virus and good at modulating the immune system so we get the right immune response. So I would, I've known Dr. Fauci for 25 years. I think he is very, very rigorous in everything he recommends, and he doesn't overplay what we know. Of course, we all hope for the best. That's what keeps us going day in and day out. But we can't paint an overly rosy picture just to have everyone disappointed when biology talks.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.